If you are a woman who has experienced a UTI, you are not alone. Over half of all women have a UTI at least once in their lifetime. Why are UTIs so prevalent? Why do UTIs keep coming back after treated with antibiotics? What exactly is a UTI and what causes them? Let's see how much we really know about the common pathogen E. coli. Urinary tract infections, or UTIs, include the following symptoms: pelvic pain, frequent urination, urgent urination, a burning sensation when urinating, blood in the urine, and/or pain with sexual intercourse. Sometimes an infection can go unnoticed by a patient because asymptomatic bacteria, or ABU, will grow in a commensal relationship with the host and show no symptoms. Urinary tract infections are one of the most common bacterial infections of humans. Normally, urine is sterile. Therefore, it is widely believed that UTIs are caused by bacteria strains from the fecal flora that have entered the urethra. Over 50% of women will experience a UTI in their lifetime, most likely because the urethra is shorter in women than in men. And bacteria originated from outside the body can grow and reach the bladder easier. UTIs have 4 categories: ABU, in which the bacteria are only present in the urine and cause no symptoms; cystitis, in which bacteria have reached the bladder; pyelonephritis is when bacteria are found in the kidneys; and urobsepsis, which bacteria are found in the blood. Escherichia coli is the cause of more than 80% of all UTIs. E. coli is normally a bacterium in the gastrointestinal tract that has a commensal relationship with the host. However, some E. coli strains have the ability to cause disease. E. coli outbreaks that are caused by food contamination are intestinal pathogens, while the strains of E. coli that cause UTIs are extraintestinal pathogens, or XPEC. XPEC strains do not cause disease in the intestinal tract, but are common colonizers of the intestine. A healthy human commonly has XPEC strains in the fecal flora or vagina of healthy women. This further supports that E. coli from fecal flora is the likely culprit of many UTIs. E. coli is a gram-negative, rod-shaped bacterium. E. coli are motile thanks to the flagella, which whips back and forth to move the cell. E. coli, being motile, found in fecal matter, and are commonly found in the vagina of healthy women, makes it very easy for them to cause UTIs in women via fecal matter. So how do we prevent and treat this infection? Wiping front to back after using the bathroom will decrease risk of fecal matter entering the urethra. In general, keeping the area clean will also prevent the spread of harmful bacteria. Peeing after sex can also reduce the risk of getting a UTI because it flushes out the urinary tract and any bacteria that may have made their way into the body. In addition, drinking plenty of water will make you use the bathroom more, which in turn helps flush out any lingering bacteria. After diagnosed with a UTI, you should continue these good habits. In addition, doctors will prescribe antibiotics almost immediately after a patient tests positive for a UTI. Antibiotics will normally kill the pathogenic bacterium and the symptoms should decrease. However, sometimes they don't. Many women find that even after taking antibiotics, they continue to get recurring UTIs. Antibiotics should kill off all the infectious E. coli strains in the urinary tract, and urine should be sterile again. This means resistant factors in the genes of that strain have been expressed, and the surviving bacteria are now antibiotic resistant. How can we prevent UTIs when bacteria keep getting stronger? One study found that the ABU bacteria in the urine had few fitness genes. Bacteria in the bladder had more, kidney bacteria had even more, and bacteria found in the blood had the most fitness. This shows that bacteria have evolved to inhabit further up the urinary tract. The environment of the intestinal tract is very different than the urinary tract, so any evolution of microbes to make them more fit in the urinary tract would only occur in the urinary tract itself. This study has shown that the strains have evolved from fecal matter to survive in the urinary tract. Antibiotics are a selective pressure that causes these strains to evolve even faster. By treating the patient got worse because E. coli is a rapidly evolving bacterium. This video is from a Harvard Medical School study that shows E. coli growth under different antibiotic conditions. The outsides of the mega petri dish, agar, have no antibiotics, and the dosage of antibiotic increases towards the middle of the dish. As you can see, the E. coli grew in the non-antibiotic media only because that is where they could survive. After just a few days, a mutant strain appeared on the antibiotic media. This strain has developed an antibiotic resistance, and E. coli continue to spread throughout the low antibiotic region. It doesn't take long for the bacteria to mutate again in order to survive the higher dosage of antibiotics in the next region. This shows how rapidly E. coli mutate to become antibiotic resistant in the lab. Imagine how rapidly E. coli can mutate in a human host. When doctors prescribe more and more antibiotics for UTIs, the infectious E. coli in many women only gets stronger. What will happen if E. coli becomes too strong for the next antibiotic? E. coli is a bacterium that learns as we fight it. To treat UTIs, more research must be done on how to stop E. coli infections, because antibiotics are not working. How much do we really know about this common pathogen? We have just barely scratched the surface of E. coli and its potential.